Hello students, welcome to EPG Pathshala. I am Rashmi Sinha from Indira Gandhi National Open University. Today we are going to talk on the module Significance of Age in Growth Studies from the paper Human Growth, Development and Nutrition. We often talk about age in different contexts. Let us learn what is the significance of growth of age in growth studies. So the objectives of the study in this module are stages of human life, types of growth curves and its significance, significance of age in growth studies, and methods for analyzing the age. All organisms grown with time and the physiological and biological functions also change to a great deal with time. In human, the individual passes through different stages of growth, and in every stage the body undergoes various types of modifications, development and even degradation after a certain period of time. Aging is a term which is used to determine the process of becoming older or more mature. Maturation means being fully developed in terms of physical appearance, behavior or thinking. The process of maturation is completed by various developmental processes. These changes lead to changes in the body. Age is a very important factor to study such changes and how the changes differ from one population to another due to various intrinsic and extrinsic factors. Now, what are the different stages of human life cycle? The various developmental stages in the life of human cycle are prenatal life, that is the first trimester, second trimester and the third trimester. Postnatal life, that includes the neonatal period, infancy, childhood, juvenile, puberty and adolescence and adulthood, which is the prime and transition, old age and senescence. Now, during the different stages, the body undergoes various physiological and psychological changes. To study the changes, age plays a very important role, as with the help of changes between populations could be studied. Age is thus used as a factor which is considered while conducting growth studies. Now, changes in various stages of human life, what are they? Human beings experience various changes with growing age. These changes are dependent on various environmental and genetic factors, but in general, the stages are universal in nature. Although these changes are universal in nature, their onset can happen at different time and may lead to different physique with slight differences when compared with one another. The most important changes are physical maturation with psychological and cognitive development. These changes are seen with age and thereby play a very significant role in studying the variations of changes in growth of the body. Now, from this table, let us see the various changes in different stages of human cycle. In the prenatal life, that in the first trimester we can see it lasts from fertilization to 12 weeks and embryogenesis takes place. In the second trimester, which is from the 4th to the 6th lunar month, rapid growth in length is there. In the third trimester, from 7th lunar month to the birth, rapid growth in length and maturation of organs is characteristic. Postnatal life, that is after birth, in the neonatal period, it lasts from the birth to 28 days. This is the most rapid rate of postnatal growth and maturation. Extrauterine adaptation takes place. In infancy proper, which lasts from 1 month to 1 year, rapid growth and velocity with steep deceleration in growth rate takes place. In later infancy, that is the entire second year till the end of lactation, deciduous teeth erupt, permanent teeth get calcified in socket, physiological, cognitive and behavioral development takes place. It's a nutrition dependent phase and development of nervous system is very fast and thus learning ability is launched. In childhood, again, There are three substages. Early childhood is from 3 to 5 years, middle childhood is from 6 to 7 years, and late childhood is 7 years till to puberty. In this stage is characterized by, in this case, the rate of growth is slow. Stable growth with increase in learning ability takes place. See the mid-growth spurt, eruption of first permanent molar and incisors. There is a cessation of the brain growth and dependency for care and feeding. In juvenile stage, it is from 7 to 10 years in girls and 7 to 12 years in the boys. It is characterized by there is a capability of self-feeding, there is a slower growth rate, cognitive transition leading to learning of economic and social skills. Puberty. Puberty occurs at the end of juvenile stage and lasts few days or weeks. In this, there is reactivation of central nervous system for sexual development and increase in secretion of sex hormones. Adolescence, an important stage in human life cycle, and it is there after the onset of puberty, which lasts for about 5 to 10 years. It is characterized by the growth spurt in length and weight. Permanent tooth eruption almost is complete. There is a development of secondary sexual characteristics. Socio-sexual maturation takes place. There is intensified interest and practice of adult social, economic, and sexual activity. Males have broader shoulder, more muscles, while females have broader hips and more fat. There is onset of oogenesis and spermatogenesis, and change of voice is noticeable in males. Adulthood, prime and transition. It is from 20 years to the end of childbearing stage, and in this case, homeostasis is physiology, behavior, and cognition is there. Menopause for women at 50 years of age is also observed. The stage of old age and senescence, it's from the end of the childbearing stage till the death. This is characterized by the decline in body function and many body tissues and systems. Arteries become thick due to calcification. Teeth gets loosened in their sockets. There's a decrease in water content. Immune system also decreases its ability. Mineralization increases. Bones become brittle. Fiber system decreases, and elasticity of the heart and lung muscles are also decreases. Growth curves. These changes are of significant importance, and due to specification of changes, the various developmental stages are marked. These developments feature the growth of the body. The various changes in growth are described in a growth curve which was given by Richard Scammon in the year 1923, and it is also known as the systemic growth curve. This curve was based on postnatal growth by the analysis of weight of body, specific tissues and organs. According to Scammon, the growth of human body could be summarized in 4 curves, namely genital curve, general curve, neural curve, and lymphoid curve. What are the different types of growth curves? There are 4 main types of growth curves which mark the development of human body. Different tissues fall under different growth curves which determine their characteristic developmental pattern. Genital growth curve. This type of growth curve is characterized by the growth of primary and secondary sexual characters. The primary sexual characters are developmental of testes, ovaries, penis, whereas the secondary sexual characters are the development of breast, pubic and axillary hair, facial hair, growth of larynx. This curve shows acceleration with the onset of puberty and it slightly varies in males and females. From birth till juvenile phase, both males and females show slow and similar growth in sexual characteristic development. General growth curve describes the growth of the body as a whole. It includes growth of body in terms of height, weight. It also denotes the growth of most system of body, that is the muscle mass, respiratory system, heart, etc. It is generally an S-shaped or sigmoid curve and shows steep acceleration with the onset of puberty. Although height stops growing after the individual attains adulthood, but the other organs and systems continue to grow. What is neural growth curve? This curve shows the growth of the brain, nervous tissue and its associated structure. These types of tissues experience rapid growth during the early phase of postnatal period. The neural tissues show steady gain after 7 years of age with slight growth spurt during adolescence. Lymphoid growth system. This type of growth curves describe the growth of lymph glands, thymus glands, tonsils, appendix, and lymphoid patches of tissues in the intestine. These tissues help in the development of immune system, including the increase in resistance of infectious diseases. From infancy to the end of juvenile phase, there is an intense growth of lymphoid system. The curve reaches its peak point in 11 or 13 years, and at these ages, children have twice as much as lymphoid tissue as an adult. The growth curves, the genital growth curve, the neural growth curve, lymphoid growth curve, and general growth curve in the postnatal growth. Now, what is the significance of age in growth studies? Age means the part of the duration of being which is between its beginning and at any given time. It is countable and one of the stages of life at which some particular changes or development occurs, which distinguishes itself from any other stage of life. In growth-related studies, age plays a very significant factor as age is considered as all the physiological, psychological and cognitive development of an individual or a population could be best understood with respect to the age. Age is also a universal phenomena, and the changes that an individual undergoes with the age is also universal with slight changes in the onset of changes. The development and maturation of an individual could be studied on a dynamic basis with the help of age. With the growth in age, various changes are seen in various body systems. Age is an important factor as the various changes in growth is resulted from changes in body system which could be studied with respect to age. These changes are studied keeping in mind the changes with time. These body systems are the skin. Let's talk of the skin first. With growing age, the skin flattens due to the loss of many tissues such as subcutaneous fat, skin cells, sebaceous glands, sweat glands, melanocytes, and hair follicles. With age, lentigo occurs, the blood flow to the skin also decreases, and nerve endings are lost or become less sensitive, which results in effectiveness for protection against bacteria or an insulator as a thermal regulator and as sensory receptor. These results in wrinkling, loss of elasticity, freedom of movement and expression are inhibited. The slowing of circulation results in slower healing. The loss of color is also seen as the hair becomes gray. Skeletal system, we witness the loss of bone matter, which is the primary change which we notice in the system. The basic cause of the bone loss is the relative rate of production of osteoblasts and osteoclasts changes so that more bone matter is dissolved than is laid down. This loss is much greater in women than in men. Other factors that are seen in the skeletal system with growing age are loosened cartilage around the joints, depleted lubricating fluid in the joints, and hardened and contracted ligaments. These factors occur more in men than in women. There are significant effects of these changes on our health status because as the bones become brittle, they become less supportive of our activities, resulting in less activity, which in turn results in poorer health. The excess bone that has been taken up tends to reside in the arteries and local blood vessels, causing decreased circulation. The muscular system. Muscle cells are post-mitotic cells which are unable to replace themselves once they are formed. So all muscles loss is permanent. Muscular response gradually slows down with age even under the best conditions, although the loss of muscular capabilities is mostly the result of cell loss due to inactivity of the body. With the loss in muscle cells, weakness and slowness or muscles also increases. Exceptions are also seen in the muscles of the left ventricle of the heart and the diaphragm, as they do not lose muscle fiber with age since they are continually active. The neurosensory system, in this, the nerve cells, the neurons, are also postmitotic fixed cells, and with the growing age they lose dendrites, dendritic spines and end branches, all of which are the intermediary parts necessary for the communication with one another. As the nervous system ages, signal conduction becomes slower, but much more so as the nerve synapses than within the nerve cells themselves. There is a loss of taste buds, olfactory cells, nerve endings in the skin, and even brain cells. The hearing sensitivity degrades, especially in the higher ranges, as the ear osses harden. The vision changes as the lens of the eye becomes less flexible and yellows, and this results in the requirement of more light and glasses for close work. The gastrointestinal tract, the mouth, the esophagus, stomach, small intestine, gallbladder, liver, pancreas, and large intestines all come to form the gastrointestinal tract. In the mouth, taste buds and teeth are lost after adulthood. Problems with esophagus with growing can be dysphagia, subsequent pain, heart burn, belching, and general epigastric discomfort, which is also seen after adulthood. Atrophic changes in the stomach, especially hypoacidity and achlorohydria, are common with growing age. Cell replacement is active in small intestine, so few changes occur with aging, but obstruction are not uncommon. Gallbladder problems are most marked after 65 rather than in middle age. Problems with pancreas usually begin to develop about at the age of 40, and they do tend to increase with age, especially if the islets of Langerhans are damaged or if they become overstressed by excess sugar consumption, which leads to diabetes development. The large intestine is most susceptible to disease with aging, but is also most amenable to preventive measures. Obstructions of the bowel, carcinogenic or otherwise diverticular diseases, hemorrhoids, and gastrointestinal discomfort are common in elderly as in the fecal incontinence. The cardiopulmonary system, in this, the heart disease is the most common cause of death in people with the age 65 and above. The heart muscles reduce in size and aorta loses some of its elasticity with growing age. Coronary artery disease increases as activity declines. Plaques accumulate on the interior of the arteries, causing atherosclerosis, and the arteries harden as they lose their elasticity, arteriosclerosis taking place. Both these factors resulting in the lessened blood flow. Hypertension or the high blood pressure also increases with age. The respiratory system also undergoes changes with age. The air sacs, airways, and tissues lose elasticity and become more rigid. These lead to the changes in the body and other function. The cerebrovascular system, the atherosclerosis and arteriosclerosis in the blood vessels that supply the brain is called cerebrovascular disease and causes stroke, which is the main cause of death with growing age. Prior to the complete occultation of the blood vessels, the brain is deprived of adequate blood flow, resulting in the less than optimal brain functioning, such as confusion, disorientation, and memory loss, which is mostly seen in old age. The bladder, urethra, urinary tract, prostate, and kidneys, all part of urinary system, show decrement its incidence in most people with age. Thus, urinary incontinence and urinary tract infection are most common problems encountered. The capacity of the bladder reduces by half in elderly, thereby the need to urinate is more frequently. From the age of 50 onwards, prostate problems increase in frequency among men than in women. A decrease in number of nephrons, the filtering module of the kidney, results in decreased efficiency of kidneys, which results in the increase in health problems with growing age. Endocrine system is one of the major systems of the most that functions the working of hormones in our body. The pituitary, thyroid and adrenal tends to function adequately throughout the life, while the size of the thyroid gland does decrease significantly with age. Sex hormones such as estrogen and testosterone are seen to increase in female and male respectively with the onset of puberty. In the genital system, the changes tend to be non-problematic. Generally, responses slow gradually in both men and women. In men, the prostate may enlarge and may create urinary problems. More changes occur in women than in men. In women, the changes are more visible as there is development of breast due to increase in estrogens. In men, beard occurs, changes in the voice, and also development of muscles, which is due to an increase in the testosterone. In case of the immune system, the earliest deterioration in our bodies is seen in the thymus, which is the heart of the immune system. The thymus begins significant involution by the age of 3 years. Two types of white blood cells, B cells and T cells of the immune system, malfunction and weaken with age. With growing age, B cells lose their vigor in attacking bacteria, viruses and cancer cells, and the T cells lose their vigor in attacking cells foreign to the body such as cancer cells and transplant cells. B cells and T cells also malfunction and attack normal healthy body cells, which are seen mostly after adulthood during the old age. As we understand that age is a significant factor in growth studies, and there are different methods for estimating the individual's age. Age of an individual could be determined by 6 methods, and these methods are: physical changes of an individual is needed with time. There are even specific calendars which are prepared to study the significant changes in life of an individual with age. Chronological age. Now, this method of age estimation gives the individual's age in terms of years, months and days. It is mostly used to determine one's average age with respect to the day, month and the year. Let us take an example. If we need to find out an individual born on 2nd April 1990 on 10th February 2016, then one have to subtract 10th January 2016 by 2nd April 1990. Skeletal age or bone age is determined by the intensity of the ossification of bones. It is an indicator of physiological maturity and it is assessed with the help of radiography. The concept behind is that each bone has primary center for ossification and it passes through various stages of enlargement, and shaping of ossified areas requires times. In some cases, more than one center known as epiphysis is present, where ossification begins independently without the help of the main center and finally reaches a stage where it fuses with the main body of the bone. In this technique, that is radiography, the changes could be noticed on the radiograph, which clearly distinguishes the area of ossification. The skeletal age is clearly defined from the number of centers developed or present along with the stages of development of each center. In theory, any or all part of it could be also used to give the assessment of skeletal maturity, but in practice, hands and wrists are used. This is done as a radiograph of hand could be easily done without any radiation being delivered to the other parts of the body, and it requires a minute dose of X-ray and only the minimum X-ray equipments. Generally, the left hand is used with the palm placed downwards on the X-ray film and the X-ray tube being 75 centimeters above the knuckle of the middle finger. The figure of the skeletal maturity is derived by comparing the given radiograph with the set of its standards. The bone is passed through the set of standards and given a particular score, which is then compared with the range of scores of a standard group. Now, what happens in secondary sexual character? The development of sexual character is an important phase in the life of any human. With the end of juvenile phase, one enters the pubertal phase where there is experience of growth hormones along with sex hormones. The development of reproductive system and secondary sexual characters occurs and adolescent spurt is observed, which leads to linear growth of body. Although the onset of spurt is different between males and females, and in females it occurs 2 years earlier than that of a male. Puberty lasts for few days or months and is consecutively it is followed by adolescence phase. During this phase, the secondary sexual characters develop. In females, oogenesis starts along with the development of breast, axillary and pubic hair, and bones become pear-shaped as the hips broadens and more accumulation of fat occurs in the hip region. In males, there is a change in voice with the development of beard. Chest, body and pubic hair also develop with broader chest and more muscular development. In females, the development occurs from the age of 10 years, whereas in males, such features are observed only after 12 years. Dental age. Dental age is determined by counting the number of erupted teeth and then relating it to the standard figures. Another method to calculate dental age is to see the stages of calcification of teeth with the help of X-ray of the jaw. This method gives an approximate assumption of the age of the individual. Depicts the determination of age with the help of dentition. In case of the temporary or milk C, sequence of eruption of teeth is like there is a medial lower incisors, then medial upper incisor, lateral upper incisors, lateral lower incisors, first molars upper and lower, canines and second molars, and their respective ages of eruption is also given in this, like the medial lower incisors, they appear between the 6 and the 8 months. In case of permanent teeth, what are the different sequences of eruption? Let us see. We get first molar upper and lower, then medial incisors upper and lower, lateral incisors upper and lower, first premolar upper and lower, canines upper and lower, secondary premolar upper and lower, second premolar upper and lower, and third molar upper and lower. And these are also there between the ages 6 to 7 years, like the first molar. So all these eruptions take place between 6 to 25 years. Decimal age. Now in this method, the age of individual is determined with the help of decimal age calendar. This method is useful in age grouping method, where the age of individual is denoted in terms of neutral, positive or negative factor. In such a method, the value is considered from the decimal age calendar for the required date, which is then subtracted by the age of the individual by considering the subject birthday with the help of decimal age calendar. Like, let's take for an example, if we need to find out individual born on 2nd April 1980 or say on 10th January 2016, then what we will do is we will have to subtract the value from 10th of January 2016 by 2nd of April 1990 using the decimal age calendar. And according to this, the age would be 25.776. Thus, the age of the individual could be written in the following ways: 25 plus, since after the decimal the value exceeds 0.5, 26, again since the decimal age of the value is closer to the next value, 26 with the difference of 0.3 which is less than 0.5, and the age could also be written as 25 if the value was 25.5 which is considered to be neutral. Shape or morphological age. This is also known as the research age and is regarded as research problem. It is extremely difficult to assign and is not merely done by calculation of height and weight. It involves a set of measurements on the individuals. In this method, a combination of body measurements are taken into account and all the measurements changes with the age but are independent of final shape and size. It is not of much importance as it is research problem as the individuals are characterized by various maturity levels. Let us summarize what we have learnt in this module. Age plays a very important factor in growth-related studies. Age is considered as a dynamic factor which helps in the study of various developmental stages that leads to maturation of an individual. Age is also used as a parameter to determine the growth of a population or an individual. Human beings undergo various phases of development, and the most rapid growth of development is seen in the postnatal phase of life. The prenatal phase is divided into 3 trimesters and it lasts till the time of the birth. During this phase, rapid development occurs in length and weight of the body. The postnatal phase is divided in neonatal phase, infancy, childhood, juvenile, puberty, and adolescent phase. Adulthood is the transition phase, and by the end of this phase, the body experiences degradation in its functional ability and structure. The estimation of growth is done by various methods, out of which cross-sectional method is most widely used while conducting studies in the field. Growth rate is a feature which is widely dependent on intrinsic and extrinsic factors. It thereby brings about changes in growth pattern. Age is a very important factor, and the measurement of age of an individual could be done with the help of chronological age, skeletal age, secondary sexual characters, dental age, decimal age, and research age. Chronological age and decimal age gives the accurate age of the individual, whereas the skeletal age gives the approximate age of the individual. The research age is not considered as an appropriate method and is mostly used as a research question. Thank you.